Bundled care is sort of what we're usually used to. You get a group of choices for care, and that's all you get, and you work within that bundle. So unbundling is kind of like when cable TV moved into streaming services, and so suddenly you can choose from a whole suite of things, which is great, and consumers and patients really like all this choice. You can't go fully unbundled because you end up in the same place we are with streaming services, where you're paying the same amount for your cable as you used to with streaming, and so you do have to have some bundling. Bundling is not bad. We like things that come in groups, but we want choice within what is in the group, and we want that choice to be related to us personally, and so I get to choose what is the right bundle for me, which is going to be different from you and someone else. And if you're an employer and you're thinking about your employees, you have to be able to choose the bundles, whereas before, the traditional model is your employer gave you one bundle and that was all you've got. So how can you provide more choices so that your employees feel like they had a personalized bundle? Hybrid care is sort of, we went all virtual during the pandemic, and before the pandemic was all in person, and now hybrid care is sort of this even middle. And so it's saying what can be done virtually and what makes the most sense to do virtually, and then what do you need to do in person. There's obviously certain things that just have to be in person, and what we're seeing is consumer sentiment wants to use telemedicine for certain things, but not necessarily everything. So virtual only models really are not the way of sort of the future, or the preferred way for patients and consumers, because we do like interactions with others, and we want to build that relationship with the provider. So price transparency is a really exciting topic, but there's some really recent legislation in the last couple of years that's coming out and coming into effect, most importantly in effect now, for hospitals and payers to show how much things cost in a way that the consumer can understand so that they can shop around. And we're used to seeing this in the prescription space, where you can look and say, well, CVS charges me $5 and Walmart's going to charge me $7 and Amazon will charge me $3, so I guess I'll get my prescription from Amazon. And so it's that same concept of going to your 3 different local hospital providers and saying, what is my surgery going to cost? Except for it's much more complicated than a prescription price. So that's the problem with price transparency, is it's so incredibly difficult. And it's customized because the price for the procedure from patient A to B is going to change based on the individual person and what happens during the procedure. So it's very hard to predict what the price is, but still there needs to be a level of some number, and not right now in this system has been no number is provided, and you really have no clue what your bill is going to be, versus giving you a ballpark estimate that is going to, and more like contractors and your home repair. Like it's not necessarily going to be the final number, but it gives you room to budget and plan for, and then to be able to compare. And you might still go with it. Doesn't mean you're going to go for the lowest price, because there are other factors at work.